Dr. Rohini Paul. This is about nursing skill tip. So I want to explain, not in detail, in brief, about fall risk assessment. So now, the early days, patient used to have a fall and we went and took care of the patient. Now, this fall risk assessment is a preventive aspect where I will not allow my patient to have a fall. That is what it is. So I want you to understand there are many different scales are there. Again, the scale will give you the conclusion to rate how much my patient have a chance of fall. That is a number again. So how do I come to a conclusion with that number? In this, I'm talking about Moore's fall risk assessment scale. Again, a scale will give you a number. So what are the parameters to simplify it? The history of the patient. Is that patient having a history of fall? That is one aspect. Anything related to the patient's physical or mental diagnosis of disease condition, which will definitely have a chance of fall. Is my patient ambulatory? That is one aspect which again will come to a conclusion of a rating. Then, is this patient have an IV access? That's one more thing. Is this patient having a gait? That means he has an imbalance. That is very important, very important. Then the patient's mental status. So this is also added to all this, which when I going to give a rate of everything, which is already there in the Moore's fall risk assessment. So when I put my patient observation, compared to this, come to a conclusion of calculating the number, I have the final which you will see in the screen, 0 to 24. It's a very mild risk of assessment which you will come to a conclusion how to take care of your patient. 24 to 45, it's a moderate level where this much chance my patient will have chance of fall when he is with me in the hospital. 45 and above, if I am going to come to that conclusion of that number, he has a high risk of fall. So I should know how I should protect him, preventing from fall when he is with me in the hospital. That is all about Moore's fall risk assessment. Now, when we have all that, there is a reassessment. This is when do you do this assessment? At the time of admission, I do all this assessment with a number. I come to the conclusion, how will I take care of him? The second level, the same patient goes for surgery. He is in ICU. Coming back to me, he is different. He may would have not been a high risk, but after surgery coming back to me, I do a reassessment because his rating of fall risk is going to be very high. Then if my patient, maybe for example, 8 a.m. I checked him, 11 o'clock they started him on anticonvulsive drug, the gait is going to change. I will assess him again. Antihypertensive drug, reassessment is important. Then when do you do daily assessment? Once a day, morning 8 a.m. is good enough and you do your assessment. I am sure this is very important, preventing fall of your patient when he is with you in the hospital. And I am sure this will help you to go forward to teach your nurses in the nursing school and in the hospital. Thank you very much.